An abnormality in your breast was detected during an imaging study. Your clinician has recommended a breast biopsy to accurately diagnose this finding. A stereotactic biopsy pinpoints the exact location of a breast abnormality using a computer and X-rays taken from different angles. During this procedure, a small amount of tissue will be obtained from the area of concern in your breast. A pathologist will examine this tissue under a microscope to determine if it is malignant, cancer, or benign, not cancer. Image-guided biopsies, whether ultrasound, stereotactic, or MRI, are less invasive than a surgical biopsy and provide the same degree of accuracy. Some of the abnormalities that are biopsied are benign, not cancerous. If this can be determined with a simple needle biopsy, a more invasive surgical biopsy can be avoided. Before your exam, a technologist will review with you the informed consent document as well as any special preparations that may be required. The informed consent document provides an overview of the procedure, desired benefits, possible risks, and your rights as a patient. If you are viewing this video on our website, you can access the informed consent document under Patient Information. Please be sure to discuss any questions or concerns you may have with a technologist or radiologist. A technologist and radiologist will work together to perform your biopsy. You will lie on your stomach on a special biopsy table with your breast positioned through an opening in the table. It is very important that you lie still to ensure accuracy of the procedure. Your breast will be carefully compressed to help keep it immobilized during the procedure. The technologist will take low-dose X-ray images of the breast at different angles. The radiologist will review the images on a computer and select the area from where the sample will be taken. Because the three different viewpoints form a triangle, the computer knows the precise point where the tissue sample is to be taken. The skin over the area of concern is cleansed and a local anesthesia is administered to numb the area. You may feel a stinging sensation at first, but then you should not experience any pain. A tiny nick is made in the skin, and the biopsy needle is inserted partway into the breast. Additional images are taken to check positioning of the biopsy needle. You will hear a click sound as the needle is advanced into position, and another image is taken to confirm optimal positioning. The technologist will then turn on a vacuum-assisted device that enables the tissue samples to be obtained. A number of breast tissue specimens are obtained through the needle. An internal tissue marker is placed at the biopsy site to mark this area for future reference. The specimens will be sent to the pathologist for diagnosis. When the procedure is finished, a small protective bandage is placed over the biopsy site. Stitches are not required. You will then be escorted to the mammography room, where a gentle 2-view mammogram will be taken to document the location of where the biopsy samples were removed and to verify the location of the tissue marker. You may experience minimal discomfort following your exam. Some bruising and soreness is expected. You will be asked to keep your bandage in place for 48 hours after your procedure. We request that you limit your daily activities for 1 to 2 days as you recover. Be careful when reaching and stretching with your upper body. We specifically recommend no strenuous activities for the first 24 hours. We recommend wearing a soft, supportive bra for the first 24 hours following your procedure. To ease bruising and mild discomfort, you may apply a cold pack as needed. If a pain reliever is needed, we ask that you take Tylenol or acetaminophen. Do not take aspirin or ibuprofen products for 48 hours after your procedure. You will also receive a copy of these instructions following the procedure. Your tissue samples will be sent to a pathologist for analysis. These results are usually available within 3 to 5 working days and will be faxed directly to your referring clinician, who will discuss these results with you. They will recommend your next course of action. Most patients only experience mild discomfort during the breast biopsy. Occasionally, some patients experience a moment of pain, and may require additional numbing medication. Because we are breaking the skin's barrier, there are minor risks, including, but not limited to, infection, bleeding, vessel injury, or allergic reactions to the medications used. As the patient, you are our priority. If there is anything that we can do to make you more comfortable before or during the procedure, please let one of our staff members know. A staff member will contact you the next business day after your exam to inquire how you are doing and answer any additional questions you may have. For more information regarding this procedure, or if you have questions or concerns, please call our office at 360-493-4600. You may also visit our website at www.southsoundradiology.com. Thank you for choosing South Sound Radiology.